Anytime you have a patient that comes to the emergency room with acute scrotal pain, you need to have a differential diagnosis. And your diagnosis here really should include a couple of things. Testicular torsion, which we have gone over in the previous video. Torsion of the testicular appendages. And you also want to make sure you think about epididymitis and orchitis. And of course, vasculitis and incarcerated hernias. So testicular torsion we already talked about in another video. We'll talk about this one here, appendiceal torsion, epididymitis, and orchitis. So let's go through our anatomy again really quickly. And so we'll run through it real quick. You got the cremaster right there, the parietal tunica vaginalis. This whole thing's called the spermatic cord, and it also includes within it a vein, artery, and the vas. Here's the vas on the back connecting to the epididymis. And, of course, the testicle. And these little pedunculated things, these are the testicular appendages. So first let's look at appendiceal torsion. And there are 4 of these little testicular appendices. And they're these pedunculated things, and they can torse, they can twist, and it hurts, but it usually won't cause any nausea or vomiting. And you really want to distinguish this from testicular torsion. So I would get an ultrasound, and on the ultrasound you're going to see that there's normal flow to the testicle because it's only the appendix thing which is twisted. So now let's look at epididymitis, which is really inflammation of the epididymis, and this is usually a bacterial infection that's causing it. And the common teaching is that in the really young and the older people, it's going to be, a colonic type bacteria like E. coli and Klebsiella. And in the sexually active people, and they say that's less than 35, that it will be STD bacteria. Actually, these are called STIs now, sexually transmitted infections. Now, this is, of course, an arbitrary distinction, because who's to say that a 12-year-old can't be having sex, or a 15-year-old can't be having sex, or for that matter, a 42-year-old or 43-year-old. And so, just keep that in mind, that if they're sexually active and they're older, they could easily have an STI, which is causing their epididymitis. And what you'll notice on exam is that the posterior aspect, where the epididymis is, will be tender. However, if you have tenderness in this area, or you just are unsure that this is epididymitis, again, get an ultrasound and make sure that it's not torsion, because that's the bad thing. But you might see hyperemic flow in this inflamed and infected epididymis, and then the ultrasound will come back being read as epididymitis. And remember that in testicular torsion and epididymitis, you're going to have a Prain sign, which is positive, and that is scrotal elevation is going to relieve the pain. So maybe if someone puts on a pair of tighty-whities, which gives them a little bit of scrotal support, it's going to decrease their pain. So your treatment for these guys would include bed rest, icing it, NSAID, anti-inflammatory antibiotics, anti-inflammatory pain medicines, and antibiotics. And antibiotics would be directed at whatever you think the cause is. If you think it's an STI, then treat STIs. If you think it's a urine infection, then treat the urine infection. Now, you might give some sort of fluoroquinolone like Levaquin, which might kill all of it at once. And a urine, you can check a UA if you want, but they're negative in about 50% of the time. So they may not be helpful. I would send a urine culture as well, just in case you get something in there. The reason why the bed rest is because they postulate that if you lift something heavy, that you might get some backflow of urine into the vas, and that's what causes eventually the epididymitis. And so they say don't lift anything heavy. Now let's talk about orchitis, which is inflammation of the actual testicle. And whereas the epididymal ones tend to be more bacterial, these tend to be more viral in origin, right? Like you got your mumps, you might have varicella that's causing it, you can have echovirus. And if you have a patient who has HIV, you should also consider fungal causes too. Now you can also get an epididymo-orchitis, which is usually just the normal epididymal causes spreading to the testicle. and so you're going to treat these epididymal causes, like we talked about previously. And again, if you're worried that you're not sure what this is, then get an ultrasound and make sure that this is not testicular torsion, and make sure that it is just orchitis or epididymo-orchitis. Now let's talk about one last thing. Now, testicular masses, they tend to be pretty painless. You'd feel, maybe someone's doing a self-exam and then they'll feel a bump there and then they'll go see their doctor. Those should be ultrasounded and referred quickly to urologist just in case that's a cancer. Now, there is a time when it can be painful, and that's when it starts to bleed because it's growing so fast. It starts to bleed inside. So that could be a painful cause for a testicular mass. And again, if you need to, get an ultrasound just to make sure that it's not a torsion. And in this case, if it's a mass, then you want to get an ultrasound and refer them to urology. So in this video, we talked about a few other causes of painful testicles. We talked about appendiceal torsion. We talked about epididymitis. We talked about testicular masses, especially those that are bleeding inside, orchitis, and epididymo-orchitis. So that's it. All right. We'll see you in the next videos. If you have any questions, please put them down below in the comments. Bye-bye.